we have Dr. Dashore coming back up again in case you didn't see it this morning. She did a wonderful presentation on a variety of herbals. There are very detailed slides in the presentation. If you want to check those out on the website with a listing of a variety of herbals and recipes that she put together this morning for us, in case you missed that session. And if you did miss that session, I'll give a brief introduction here of Dr. Dashore. She is internationally recognized pioneering clinician in autism, biotoxin illness, and chronic inflammatory response syndrome, PANS, and Lyme disease. And as a Lyme literate holistic health practitioner and a member of ILADS, Dr. Dashore's uses of all natural plant-based protocols to help patients with chronic and treatment-resistant Lyme disease. She is also certified in the Shoemaker Protocol for CIRS. Thank you, and here is Dr. Dashore.
Thank you. Thank you. How's the post-lunch slump? Everybody awake? This is intense, so it'll be fun. It's a lot of information, a lot of knowledge, both for patients who want to be self-advocates and for the practitioners that are in the audience. It's pretty much literally as it says, a step-by-step approach. I am Dr. Shoemaker certified in his protocol for CIRS, so I will be covering both aspects of the treatment. We'll be looking at the all-natural protocols as well as what Dr. Shoemaker recommends. There is going to be some repetition from this morning for those of you who were not here, just so that there is a good flow. Now, the number one reason, the number one culprit for 100% of the patients that I see in my practice who are not getting better from chronic Lyme is underlying mold issues, exposure to mycotoxins and mold. Not so much for the autistic population. I have about 60% of the autistic children that I see around the world that have underlying mold exposure. And in the most unlikeliest of places, like I have a patient, I always remember him as Iyad from Riyadh. Riyadh is in Saudi Arabia, middle of the desert, wonderful, big mansion. Long story short, very aggressive, moderate to severe autistic, poor language, and they have about 20 air conditioning units in their house. And I asked a grandfather that how long have these units been in the house? And he said, well, I built the house about 25 years ago and they've been there since. That's what the issue was. And then, while I'm Skyping, I see these black spots on the wall in Iyad's playroom. And I found out that those spots have been painted over. They say, oh no, it's just some black spots on the wall, he must have done something. And the family had been painting those over for about 10 years or so. So we cleaned everything out. They actually flew down to the United States to see me, and it was funny. Dad flew down, not dad left because of this whole autism issue, but mom, sisters, grandfather, the grandfather flew the whole family down, and they actually rented an entire floor. It is Saudi Arabia, so they have the resources. And the kid had one appointment booked with me, right? My first appointments run about hour and a half to 2. And grandfather calls me and says, doctor, when are you coming to the hotel? I'm like, no, you're coming to my clinic. And he says, no, please come. I have an entire floor booked for you and your family to go on vacation while you treat the 12 family members that I brought who are all sick. I'm like, no. You only had an appointment for your grandson. I'm so sorry. But again, I did make appointments for the rest of the family members. They are big proponents of naturopathic medicine. So out in the Middle East. They love Ayurvedic, they love herbs. So that's what we are doing. We help them all. It was one common factor for the whole family was getting cleaned out from mold exposure. So Iyad is doing really well. He's really well. He's growing, he's calmed down, he's able to sleep now, he's eating better. Switched him to the modified SCD diet. I'll take 1 minute to talk about modified SCD. Specific carbohydrate diet is fantastic. It's extremely difficult for most families, including for myself. I tried it for 2 years because of necessity. It worked really well. So in the interim, I learned to make my life easier as the inflammatory markers came down for my son, and I started modifying it just to make sure, we still make sure that the phytates and the lectins are eliminated, but the SCD can be modified. I don't have a book or anything. It's just something that I've done practically, and I do help out many of the patients who want to add some starch back in, a couple grains back in. There is a way of modifying. There's homemade yogurts from different milks. We stay away from cow milk. There's some cheese you can add back in. There's some, couple grains you can add back in. So the modified SCD is quite doable. I've been doing it for my family for about 5 years now. Anyways, coming back here. So once again, it is a very complicated subject. Naturopathic protocols for treating chronic inflammatory response syndrome. So just make sure you have a knowledgeable practitioner on board. My mentors with this, I've been on a mycotoxin journey from 2011, really got into it in 2014, been mentoring with Richie Shoemaker and Scott McMahon for a very long time. Okay. Now, 1 in 4 people, approximately 24 to 27% of the general population is genetically not programmed to recognize mold toxins. So what happens is the body, the immune system, doesn't recognize mycotoxins as toxins or invaders. Now, these biotoxins, they sit and wait for a trigger. And many doctors here have spoken about triggers: heavy metals, active mold exposure, Lyme disease, retroviruses, vaccines. It all depends for each patient. Now, once the trigger is introduced, the result can be a variety of illnesses that often mimic something like multiple sclerosis, Parkinsonian syndrome, and a triggered genetic response is, I've seen, over and over again, it more often than not develops into CIRS, chronic inflammatory response syndrome. It's a multi-system, multi-symptom illness. It is caused by the failure of the HLAs to present toxins to the immune system. So this creates an ineffective immune response, and the inflammation just persists. I've had people that were exposed to mold years ago, like even 10, 15 years ago, and they've kind of kept steady until a new trigger is introduced. But that's because the mycotoxins will stay in your enterohepatic circulation. They are recirculated. The enterohepatic circulation is a natural mechanism in the body where reabsorption takes place to make sure that the nutrients are absorbed. And the mycotoxins keep getting stuck in your bile, just to explain it simply, and then it recirculates. So it gets stuck in there until you add a binder that goes right in there, and biotoxins are negatively charged, ionophores. So when you add in a binder that has positively charged sites like cholestyramine or Welchol, or there are some natural options that I'm going to go over, those bind the mycotoxins and pull them out of that equation of being recirculated. And then you have to make sure that the patient is not constipated. So, there's no point in having a binder if you don't eliminate. Okay. Two parts to your immune system. One is your innate or the factory installed, what you're born with. The other one is your acquired immune system. Simple explanation, acquired immune system, how when you are exposed to chickenpox, for example, you acquire immunity as you go along. So that's the immune system, the part that learns. Innate immune system is factory installed. There is no gradation. Once again, acquired and innate differentiation. If you have an issue with gluten, right, you have an allergy, if you're exposed to a small amount of gluten, you don't get a heavy-duty response. That's what I've seen. When you're dealing with the innate immune system, it goes 0 to 60. It is not dose dependent. You're exposed to live mold spores. You're exposed to dead mold spores. You get the same inflammatory response. That is why the air testing that is done by many companies or where you go to Home Depot and you purchase the air test, that doesn't really cut it for those of us who belong to the 1 in 4 people. 1 in 4 is a huge number. Most families have 4 people. It's just, so keep that in mind that I have every possible genetic susceptibility mutation that MTHFR, COMT, you name it, and the HLA pattern that is mold-related, mold susceptibility. So when I am exposed to mold, it takes a long time for my inflammation and cytokines to calm down. Within the hour, the numbers start to go up. I remember the first mold conference I spoke at was in Phoenix, and I landed there that morning. The room was very moldy, and a couple hours before the lecture, I'm blank. The brain inflammation jam, like, oh my God, how am I supposed to speak? And I was supposed to present data, statistics, my research, what I had been doing with autistic kids, with PANS. It was just, thankfully, Shoemaker had some cholestyramine, or maybe it was one of the other doctors, but I took some cholestyramine right there. There was no other option, and it kind of kept me functional. I remember that during this conference, there was another doctor that reported that this hotel in Phoenix had defective air conditioners again, and her room was like, she had 3 inches of water when she woke up the next day morning. It was just bizarre. It was a DoubleTree in Phoenix. Anyways, so what happens? When the innate immune system responds, continues to be activated, it's stuck on repeat because you have continuous exposure to mold, but the adaptive immune system doesn't respond with symptoms. 42-year-old father of 2 girls with PANS pandas, my patients, dad is great, goes to work, exercising, everything. Suddenly starts to slur. His speech becomes slurred, breathing becomes a wee bit labored. Goes to a neurologist, what's going on with my speech? He gets diagnosed with ALS. He was like, where did this come from? Of course, they did the scanning, etc. The final diagnosis was ALS, and we tested him further, and we found that there was a lot of black mold in his office. There was a lot of black mold in his garage. That is what had triggered the PANS in his daughters. They had a couple co-infections. Lyme really wasn't an issue, but it was a full-fledged PANS presentation. So there was underlying mycoplasma, there was some chlamydia pneumonia underlying, there was some parvo, but there was a very huge exposure to mold in the house. So now they said, we don't know how long you have. Like, just out of the blue, you have ALS, we don't know how long you have. This was 2 years, it has a happy ending. This was 2 years ago. His ALS hasn't progressed. For Dad, we found underlying Lyme and Bartonella. We did find mold, co-infections. Everything's been treated, all herbally, naturally. And we are looking at stem cells for Dad now. So that is another counseling that I do, that don't go into stem cells. Most parents of autistic kids, I think they're traveling abroad, other than that one study at Duke's, which is being done, by Dr. Joanna Kurtzman. But many are traveling abroad for stem cells, and it is always advisable to make sure the underlying inflammation pathogens are all treated before you spend, $100,000 on stem cells. Okay, fatigue, weakness, brain fog, headaches, dizziness, muscle pain. Many symptoms you will see overlap with Lyme and co-infections. Often that becomes very difficult, and I have patients that are being treated for chronic Lyme and they keep being treated for years and years without looking at underlying CIRS, and once you treat the CIRS, everything seems to work better and flow better, and they start getting better. See, another simple diagram. But this gives you information on the left side you'll see non-HLA susceptible. HLA is a genetic testing, human leukocytic antigen response, which is done via blood work to see if you are susceptible, if you have the HLA pattern for multi-toxin issues that your body cannot handle, or chronic Lyme, or low MSH. We'll learn more about MSH. So if you don't have the genetic susceptibility for mold, you see it's very simple. It's removal from the body. Immune system identifies it as an intruder and it's gone, right? However, if you are HLA susceptible, then you fall into this entire biotoxin pathway where we will learn more, and the next diagram is easier to understand, but you see right there in the center is the hypothalamus. The important things to remember here, all of them are the leptin receptor, the VIP, MSH, AVP, or ADH. They are all important, but leptin, many patients come to me, excellent diet, healthy diet, they keep gaining weight, just cannot lose weight. But I don't eat anything all day. I have, I'm vegan. I have a great diet, portion control, nothing works. They go on weight loss programs, they just bounce back. It's like yo-yo dieting, doesn't work. That is the leptin receptor becomes inflamed. That is your satiation center that goes off track, and that's how most patients end up gaining excessive weight. There are about 5 to 10% of people in my practice that lose weight. Vasoactive intestinal peptide, melanocyte stimulating hormone, arginine vasopressin, these are all issues that come up. Now, vasoactive intestinal peptide and MSH are anti-inflammatory and neuroregulatory peptides that occur in the body that help control inflammation in the brain and in the gut. If the numbers fall, that's where you see the chronic inflammation creeping up. Then we have the ADH, the antidiuretic hormone mechanism. There is often children that complain of bedwetting. There is adults that have to use the bathroom very often. One excuse I hear is, I drink a lot of water, so what? So what if you drink a lot of water? You're not supposed to be using the bathroom every hour. That's not normal. So these are the kind of symptoms that we look for in our patients. Reduced capillary hypoperfusion or reduced oxygenation. There are many symptoms. As you can see, there is coagulase negative staph bacteria. Have you all heard of MRSA? Right, so MARCoNS, or multiple antibiotic resistant coagulase negative staph, is MRSA on steroids. MRSA is resistant to one antibiotic, methicillin. These are multiple antibiotic resistant bacteria. These occur because when you're in a water damaged building, mold is a living organism. Volatile organic compounds are secreted by mold. Then there are additional bacteria in the environment which become more virulent because of exposure to mold, with mold being, and then if you add electromagnetic frequencies, people have cordless phones, routers, wireless phones. You live in condominiums, you have neighbors, you have smart meters. It's just bizarre. Now they're coming up with 5G. I don't know if you heard about this study. Many of you may have heard about it, that the first studies which were done with 5G in a remote location, they found hundreds of birds dead within a couple hours, after the 5G being activated. So it's a very serious issue. It's been a serious issue with my family. I have tons of EMF protection. I don't use any wireless. Everything is good old Ethernet. I don't use laptops. If I do, then I use, USB. I think that's a whole other lecture. But anyways, EMF protection is very important because these are man-made electromagnetic frequencies. And when you introduce man-made electromagnetic frequencies, the organisms feel they are under attack because they're not natural. All living organisms, those of you inclined a little bit towards quantum physics and quantum biology, all living organisms have an EM signature. We are all beings of light. We have our own signature of light, an electromagnetic signature. The body and the brain, the nerves, they use an electrical, chemical, and magnetic way of communicating with each other. And this gets seriously disrupted. When my son would go within 5 miles of an airport, his motor tics would skyrocket. The head would shake violently. I mean, I've had his head shaking motor tics cause early arthritis. He was 11 when he already had cervical arthritis. It's just because of his pandas, mold exposure. We didn't know about mold exposure until he wasn't getting to a 100% with his health. And that's how I got into all this. This is a much simplified diagram of the biotoxin pathway. And you will see that there is, actually I'll go back to this one. So there is sleep disturbances, chronic pain, GI issues. Any illness you get becomes prolonged if you are in a water damaged building. There is reduction in testosterone. The testosterone, there is an enzyme called aromatase. Aromatase is upregulated and you will find estrogen levels go up and testosterone gets sucked into that aromatase cycle and estrogen levels go up. So for patients that are living in a water damaged building with low T, do not give testosterone neat. Do not give testosterone creams and whatnot. It really won't work. You will end up producing more estrogen. The way to go is with HCG shots. But again, that's if anyone has a question, ask me that. We can go into that. My endocrinology mentor has been Dr. Eugene Shippen, who is Lyme literate, mold literate, and an absolutely phenomenal endocrinologist. Saved our lives. Okay, now this will be very helpful. So stage 1, right? Chronic inflammatory response syndrome, stage 1. Stage 1 is just the biotoxins. Almost all biological toxins are neurological toxins. They are attracted to the myelin sheath, they're in the myelin sheath, and as you know, the function of the myelin sheath is to speed up communication between neurons and different organs in the body. And when the myelin sheath is compromised, you see issues like brain fog, word finding difficulties, associations. It becomes very embarrassing for people. There is stuttering, there is one of my first symptoms that I develop when I'm re-exposed to mold is stuttering, excessive. You'll find me, if I'm in a lecture room and it's too many EMFs, moldy, water damage, there's going to be a lot of and stuttering that happens to me, and it's just, okay, looks like there's something in the environment, but it's not happening today. Not too bad. Okay, stage 2 would be, this is where the cytokines start rising, right? So you end up with headaches, muscle aches, unstable temperature regulation, difficulty concentrating. Stage 3, reduced vascular endothelial growth factor. So this means there is restricted blood flow, lower oxygen level. This leads to fatigue, muscle cramps, and shortness of breath. Shortness of breath, how do you differentiate from babesia? Babesia, you have air hunger. You have night sweats. Shortness of breath here with mold exposure is typically, you will see when patients are going up the stairs. I have patients that can walk for miles and they're okay. Then they come back home, they go upstairs for a shower, they're like, oh my God, I'm dying. That's the kind of a classic symptom. So you know that they are in stage 3 of biotoxin illness. Stage 4 is where the gut becomes compromised. There are many, many patients that are living in water damaged buildings or have been exposed that are being treated for Crohn's, colitis, autistic colitis. Autistic kids are being subjected to colonoscopies, endoscopies, biopsies. Obviously they have to be put under to go through all of these, and they don't recover. You put autistic children on biologicals, you put them on methotrexate, you shut down the immune system. And if they've been exposed to a water damaged building, it just completely backfires in your face. You cannot give steroids, you cannot shut down the immune system when the innate immune system is out of control. It's a disaster at that point. So when the gut is compromised, gluten sensitivities, ulcerative colitis, blood clotting issues, you'll see a lot of easy bruising on these people. That is what happens in stage 3. Stage 4, that's stage 4, the immune system effects. Stage 5 is low melanocyte stimulating hormone. Some people are genetically susceptible to low MSH. The HLA type for that is 1-5. If your doctor runs your HLA profile, you will see he's going to have to score it for you. There is a Rosetta Stone for that, and then you score it and you see what it is. So when MSH is low, what is MSH? Melanocyte stimulating hormone. So it has a direct effect on the amount of melatonin in your body. Okay, it triggers melatonin production in your pineal gland. MSH is the king hormone that has regulatory effect on your pituitary. So you have the downstream effects of endocrine regulation. So this is a huge endocrine disruptor if MSH goes down, if it's low. Leaky gut, because it helps in, MSH is key in absorption of nutrients in the gut. Reduces inflammation in the gut, regulates the immune system. So infections are easily acquired. You keep falling sick very often, and then you stay sick very long. Often you acquire a little bit of a cold. Everybody else recovers in a few days. For you, it becomes bronchitis. Invariably, that's one way of, it gives me a clue. Again, it's a very long intake. It's at least 1.5 to 2 hours first visit to find out what's going on. MARCONs. These are the multiple antibiotic resistant coagulase negative staph bacteria, and I'll give you a look at the mechanism. In sinus cavities and jaw, and I shouldn't just say the jaw. Jaw cavitations, MARCONs have been isolated from jaw cavitations, but many of my patients with mold issues have issues with dental health, all different kinds. They have root canals that are infected. Invariably, they need extractions. They have jaw cavitations. I had a 14-year-old little girl, had oral surgery multiple times, kept getting jaw infections. And she was, in spite of the surgeries to clean everything out, she was on 16 Advils a day. Oh, it was poor kid, but she's doing well. She's doing well. Okay. This is MARCONs, right? MARCONs will release 2 kinds of toxins, A and B, that damages the alpha MSH that I just spoke about. Okay. Then second things that MARCONs do is they produce biofilm in your nasal cavities. Then MARCONs can also cause differential gene activation, which means if you have any kind of genetic susceptibilities, they bloom. Just because you have mutations doesn't mean anything. Just because you have mutations doesn't mean that they are active. I will speak about transcriptomics as we go along. MARCONs also release certain molecules, they're called hemolysins, which cause an increase in the inflammatory cytokine. So there's more inflammation. I'm just trying to tell you how the inflammatory cycle becomes kind of chronic and feeds into itself. Okay. For adult care, history, evaluation, medical records, look for other diagnoses, look at the medical legal implications if you're renting, you're in mold. Dr. Shoemaker's 37-item questionnaire is available on survivingmold.com. We look at presentation, we do the visual contrast sensitivity test, history, exam, labs. So this is how the adult care approach goes, right? The physical exam, you look for, paleness, you look for the, a layperson would put it like, the forearm has a lot of veins on it, the face has a lot of a veiny kind of pale look to the face. The arms are long, the arms are longer than the torso. That is the morphinoid body habitus. The eyes are red. There is tremors, hand tremors, unexplained by any other neurological issues, hyperflexibility, very flexible joints, shoulder weakness when you test, and there is odd rashes and bumps on the face that again cannot be explained with diet issues. Okay, I'm not getting into this, but the slide is there for you. These are the CIRS biomarkers. You look at the HLA, visual contrast, you look at the cytokines, you look at the endocrine function, and so on and so forth. Okay, the adult care, this is how you start with toxin avoidance. Now see, I'm not an MD, so what I do is I end up acting as the QB for the practitioners who refer their patients to me for my expertise, so I'm the consultant. And this is sometimes how we proceed for people who want to do conventional treatment, okay? So CSM well called, the BEG spray, sometimes rifampin is needed. Gluten avoidance is for everybody. If you're coming to my practice, be prepared to go gluten-free and sugar-free. Those two things. Otherwise, it becomes very difficult. It's best to keep medications and treatments to a minimum when you can help yourself with the diet and environmental cleansing and whatnot. So that's the important. So pediatric, real quick, when kids usually end up with single complaints like chronic. Why would kids have such a thing, right? Chronic headaches, fatigue, chronic abdominal pains, abdominal migraines, bedwetting, or all of a sudden they get diagnosed with ADD, ADHD, PANS, unexplained joint or muscle pain, severe asthma in young children. Like kids who are on high doses of nebulizer, you have budesonide, you have levobuterols on high doses, even though it's being nebulized. And then they're also doing things like Singulair for mast cells. It's just, or ketotifen. That there is something else going on. For one little child to need all of that just to control the asthma, it's a bit much. So some kids even end up doing steroid bursts for asthma. Anyways, pediatric. So it's a lot of blood. So small children obviously have a smaller blood volume, so what do? These are the labs that are run immediately on kids. If 0 tests are abnormal, do not pursue. If 1 test is abnormal, then make it a clinical diagnosis. You can ask your practitioner. If 2 to 3 tests are abnormal, then do a full mold workup. Okay. Pediatric history is similar to the adult history. Now, this is important. This is a slide you'll probably look back at again, right? When you're doing, or you can show it to your practitioner. This corresponds to the 37 questionnaire on Dr. Shoemaker's website. Okay. Yep. Kids are harder to evaluate. They are less cooperative. Yeah. So you need a seasoned practitioner for treating kids. Now, obviously, younger children get better faster. The main principles of treatment remain the same, and some medicines used in adults are not used in children. You will not use Actos, Procrit, or VIP. VIP is now being used in kids with careful monitoring with liver enzymes, etc. That's your conventional approach. Okay. There are many areas in the brain that are atrophied. Either they shrink or there is swelling and edema. And this is actual brain damage that is caused by exposure to mold. A lot of that can be reversed. A brain MRI neuroquant. So you have left amygdala, right forebrain, both the pallidums, caudate nucleus, ventricles. These are all affected, and there is increased parenchymal volume as well. So there is swelling in the forebrain. Many children I see have big heads, and then you see things kind of normalizing as we go along with the treatment. Studies show that, like I said, most of it is reversible. Damage from water damaged buildings, brain damage is reversible. Not only that, the good news is, there's a lot other benefits. Like for my son, we had a 12 IQ point gain once we finished treating for CIRS. That was just, that's even a 5 IQ point gain is life changing for many. Okay, I won't get into this, we won't have time, but this explains the function of the amygdala, emotional and social processing that's affected. This is the forebrain where I mentioned, there's edema and swelling. So there's higher intellectual functions, you get tired, you're sleepy, you're fatigued. There is speech and abstract thought is affected, pain, hunger, thirst, blood pressure. Basal ganglia, voluntary movements, motor tics. Okay, hormonal control, the pituitary gland. These are some of the pituitary hormone effects. Thirst, frequent urination, low blood volume, low blood pressure. And how many of you here, when you touch doorknobs, you get static? Just a couple, okay? Okay. Over here, enough said that chronic inflammatory response syndrome, studies have shown now that there is mold exposure to a water damaged building is a major trigger for PANS-like syndrome, for the autoimmunity to start. Okay. All right. This is the transcriptomics test that is now available that gives us information on exactly which genetic mutations are active and what to do about them. So gene expression by nanostring, inflammation explained. I like this. When he says, when Dr. Shoemaker recently, we were speaking and he mentioned that we can no longer assume that once a patient was a CIRS patient, one would always have susceptibility to mold. Given that we can now correct some of the T cell synaptic abnormalities, it is quite possible that CIRS can actually be cured. Okay, very important. My patients that have been on azole antifungals, fluconazole, ketoconazole, itraconazole, brain MRI shows increased brain damage, and the MARCONS, the antibiotic resistant staph, is very severe. The antibiotic resistance goes all the way up to gentamicin resistant and vancomycin resistant. So I've given a couple studies there, but it's being shown that azole resistance feeds into bacterial antibiotic resistance. So that's the one thing I tried. The one thing that I would cold turkey ask you to quit if you come to my practice would be antifungals. I will put you on phenomenal homeopathic and herbal. In fact, I have my, one of the blends that I have is a yeast blend, works phenomenally. Ayurvedic herbs, Buena herbs, it's great. Plus, if you have yeast, you have to look at other things as well. All right, here are the options for antifungals, right? Herbals, vitamin B2, which is nicotinamide, is fantastic, and dietary modifications. This is Dr. Shoemaker's allopathic protocol treatment steps, which I just spoke about, and this is what I mentioned, that after treatment, redoing the brain MRI neuroquant, you see the damage reverse. It was phenomenal when I saw my own child. You see the areas that were atrophied are no longer atrophied. It's black and white, you do an MRI, you see. So let's talk about some plan-based protocol options. This is a few of these things I spoke about in my earlier. So this is the BioNexus approach, step 1 to step 7. The patients that end up with multiple chemical sensitivities need to go one step at a time. Those who can tolerate, we go 1, 2, 3, and then we add in 4, and you'll find this interesting is step 4 is where you address the root cause. You have to prep the body. Like I had many people ask me, I do a specific kind of herb or a herbal formula, and that is like, it's huge, 1 drop and I'm herxing, and that's not how it should be. The body has not been prepped to start killing at that point with herbs, because herbs will go intracellular. So let's see. Before I start the protocol, this is some of the supporting testing that I usually do for my patients. We look at hormones, neurotransmitters, mitochondria, organic acids, mycotoxins, other kinds of toxins, like we also look at glyphosate and methylation. Other environmental toxins would be obviously, Teflon associated, then there is perchlorates, then there is flame retardants, it's everywhere. Okay, foundation protocol, this is what we do. I start the patients on trace minerals, electrolytes, fulvic minerals, magnesium, ionic magnesium, and magnesium threonate. Threonate crosses the blood-brain barrier. The B vitamins, non-methylated. For chronic inflammation, I am not touching methylation until the very end. Additional thiamine is often required, especially if there is any kind of anorexia issues or eating disorder, or a child is not gaining weight, poor appetite. The most important B vitamins I look at is B1, B2, B6, and B12. Probiotics, strep-free for PANS, organ support, kidney, lymph, liver, adrenals, also lungs and skin. Gluten, amylose, glutamate, histamine, phenols. Look for these in your diet, and you may need to eliminate to feel better. We do environmental cleanse, we do mycotoxins, EMF, non-toxic lifestyle. Okay, some of my favorites, organ support, I have these listed here, don't need to go through them, they're just here for you to look at the slides later. All right, for mycotoxins, cholestyramine, Welchol, Ultra Binder, activated charcoal, Luvos clay, chlorella, Takasumi Supreme. For xenobiotics, heavy metals, vaccine detox, these are my favorites. Binders and bile binders. For GI support, remember to rotate probiotics. For IBS, I like to use IB Guard, Menthol, glutamine. Herbs would be aloe, marshmallow root, slippery elm. In my previous lecture, I gave a wonderful recipe for homemade marshmallow root and slippery elm tea. It's really wonderful for extracellular matrix healing. There are ulcers, you have IBS-like issues, you have eosinophilic esophagitis. Those are some of the things that this can be used. So if you're looking at my slides and my lectures, try to combine both of them so you get the maximum benefit. Okay. We are still at the foundation protocol. So this is usually while I send patients for testing, we'll put them on the protocol. Not everybody gets everything, but depending on the patient, this is what we do. In the diet, I mentioned the diet. Here is a little bit more specific. The sprouted organic grains, I have to decide for each specific patient, looking at the labs and the inflammatory markers, but we are able to introduce those. Camel milk, I had a lot of questions. Now I think there is only one other practitioner pretty much in the world that uses camel milk therapeutically, that has protocols. And I'm on the scientific advisory board, and it's coming up next. If anybody wants to join and ask numerous camel experts, scientists, veterinarians all over the world, they're on the scientific advisory board from different regions of the world. So it is the closest to breast milk, to human breast milk. And what we see, what I have seen, is decreased serum levels of thymus and activation regulated chemokine, or the TARC, in autistic children. It's highly nutrient dense superfood. The most important proteins are whey proteins that contain albumin, lactoferrin, immunoglobulins, very key. I've had several patients, many patients, that don't want to do IVIG. They're scared. You can't get them to do, I don't know, lots of reasons, right? You have parents who don't want to do IVIG for whatever reasons. They want to stay natural. So camel milk has been wonderful. There is a specific protocol that goes from, that I like to use, going from using from pasteurized to flash pasteurized to raw. And sometimes you start with 1 drop, sometimes you start with 1 teaspoon. It has to be monitored. It's not to be taken with, it's not to be taken in as dairy. Oh, let's have a glass of milk. You can't do that. It has various immunoglobulins. It can cause an immune modulatory effect. It is common knowledge amongst the herbalists that anytime there is an autoimmune issue, anytime there is a suspicion that an autoimmune issue might happen because of Lyme, for example, in the Lyme Western blot, when you see band 39, what I've learned through my ILADS training is band 39 is a pretty decent indicator that Lyme can cause autoimmune issues. One of the most common autoimmune issues is hypothyroid, is what I see in my Lyme patients. And there is a wonderful herbal protocol for hypothyroid. What herbs to use, what essential oils to use, what are the beneficial dietary foods. That was in my morning presentation. So also for adrenals, I had that in my prior presentation. But so anytime you're treating autoimmunity, anytime you're treating immune dysregulation, could be any kind of immune dysregulation, it is best to stay away from echinacea, elderberry, any kind of immune stimulating herbs. Echinacea, both augustifolia and purpurea, it's best to stay away. Again, I'm talking from my practice and what I've learned. And it is also very important when you're doing things like camel milk to monitor, to go low and slow, to use it therapeutically. Okay. Camel milk has more antibodies than breast milk. Yes, but they are 10 times smaller, so they are called as nanobodies. I was discussing nanobodies this morning again as well. Nanobodies are being used for research, for science, for cancer treatments as well. Nanobodies are 10 times smaller than the huge human antibodies. Human antibodies are big, they are expensive to produce, and it is difficult for them to cross into the cell, to cross the cell membrane. Nanobodies do so. They have anti-inflammatory, antimicrobial, and regulatory effects. So allergies, food sensitivities, IBS, Crohn's, colitis, inflammation, these things, if you use camel milk wisely, you see benefit. Autism, attention, concentration, again, with the gut-brain connection. In many countries in the Middle East, I have, the poorest of people, the only thing they can afford is the local herbs and camel milk. I have patients from Morocco, from Egypt, from a couple other regions in the Middle East. One interesting place is where camel milk is huge is Mongolia. Wonderful. They're very holistic people. They love herbs. Mongolia, Finland. These are like unlikely. And I met a wonderful herbalist when I was speaking in Iceland. Iceland has amazing indigenous herbs that are so wonderful for gut healing, for cognitive issues. And I'm actually speaking with the herbalist from there who wildcrafts herbs out in the wilderness of Iceland, and hoping to collaborate. Let's see. Okay. Some information to keep your home non-toxic. Okay. For herbal therapy with mold, the anti-inflammatory herbs that I use: curcumin, kudzu, motherwort, tulsi, ashwagandha, bidens, pleurisy, Solomon seal, Chinese skullcap, senega. Lion's mane is amazing, cordyceps. My own proprietary blend, the LS blend, and then turmeric pedicularis works really well. The BTDX blend, this is the Biotoxin Detox Herbal Blend. There isn't any available right now, and again, you know, it's not for the public. It's I don't have a company. This is just that we just manufacture these for my patients. So we have the Neural Support Blend, Biotoxin Blend, Neural Support Blend 2. Then we go after biofilms. We look at NAC, greater celandine. These are mild biofilm busters. They work slow and steady, but well. Look at dental health. I also do Guna, the company Guna, and I look at cytokine therapy with the TGF beta, the IL-10. I use I'm cannabinoid certified, so we do a lot of hemp oil as needed, as requested by families as well. So here are some respiratory recipes for you. Okay, so these will stay on the PowerPoints. There are a couple formulas. Now, these are herbs and the synergistic essential oils. Don't use Formula 1 herbs with the essential oils from Formula 2. That's not going to work. And we know that essential oils, I hope you know, cannot be ingested unless, there are a few that can be, but you need an herbalist. So essential oils are topical use only. Okay, so these are synergistic, and there are many ways to use essential oils, behind the ears, on swollen glands, back of the neck, bottom of the feet, side of the foreheads. You can use on your wrist. Always do the allergy testing on your wrist, or any kind of essential oil sensitivity testing. 5 drops of essential oil to 1 tablespoon of carrier oil is the typical combination that I suggest, so there is no stinging from the essential oil. Do not ingest these. Okay, Formula 1 is the natural nasal spray, all herbal nasal spray. Formula 2 is the essential oil blend. There are anti-mold essential oils for diffusers, for couple drops in the shampoo bottle if you're coming from a moldy office, few drops in your non-toxic floor cleaner, few drops in your non-toxic surface cleaner, multi-surface cleaner, right? We use that as well. Then a few drops in your Epsom salt bath. So it cleans out the mycotoxins, and it's a wonderful feeling. Formula 5 and the Extra Strength 5 is for dental health, biotoxin blend. Formula 7 is very important. Once again, there's hardly anything available. So based on the work of Dr. Stephanie Seneff from MIT, I've read a lot of her work. She's a colleague. We both speak every year at Autism One. And these are specifically organically grown. They're all organic or wildcrafted, but Formula 7 is glyphosate detox support. There's hardly any glyphosate support available out there. This will get you started. Formula 8 is for, most people are heartbroken, hurt, and they're going through grief. And Formula 9 is for inflammation. This is an overall of what's available. Special circumstances is autism. You have to look into these when a patient with mold exposure is not getting better, and autism is something that I see a lot in my practice. Vasovagal response and mast cell activation syndrome. Mast cell activation is a huge problem with people Multiple chemical sensitivities is a huge problem with people that have been chronically exposed to water-damaged buildings. Some of the things that work here is you work on the vasovagal response. We use craniosacral therapy, emotional freedom technique, microcurrent on the ear acupuncture points. It's called as auriculotherapy, and use auriculotherapy by Vol, not the ancient Chinese ones. I don't think they've been updated, but by all means, if you're a DOM, meaning doctor of Oriental medicine, you probably already know the ancient Chinese auriculotherapy points. But I like to go with the Vol. Tomatis listening program or auditory stimulation seems to help. And TM, transcendental meditation, is very useful for many of my high-functioning autistic patients, and mast cell activation. So, thank you. Thank you.
Thank you so much, Dr. Dashore. We actually have a little bit of a longer break between now and our next session, so we are able to have a Q&A for Dr. Dashore right now if we have anybody interested in coming up. Do we have any questions, takers? Great, thank you.
Oh, you're welcome. Oh, no questions? Oh, there is? Okay.
I'm using charcoal for my son. He's in a water damaged school and it's very bad. And he also we've both been to see Shoemaker years ago, and he has the, what did he call it? The dreaded genotype, is that what he used to call it?
Oh, yes, yeah, the multi-susceptible?
Yes, so we both have that. I have the multiple chemical sensitivities, the EMF sensitivities. He has a little bit of the chemical sensitivities, but in your patients, how do you use the charcoal as a binder?
Activated charcoal is used short term. I like to rotate binders every 2 to 3 months.
Okay.
So that is something that keeps the body guessing. The binder goes in with. What I'm trying to say is when you have different binders with different positively charged sites, that really works better for the negatively charged mycotoxins to get pulled. So it's good to change binders every 2 to 3 months. I mean, if you can change them monthly, great, but it gets expensive.
Right.
So every 2 to 3 months.
With your treatment, when Dr. Shoemaker's treatment protocol, you had to do the ERMI testing and have a level 1 or 2. Is that still the protocol with that?
That is no. Now, one of the things, Dr. S knows what I do. We are collaborating on a couple studies as well. He knows that I'm completely naturopathic. He knows I have my own formulas. So that's all there. No, I cannot ask my patients to move. I mean, I've got people living in apartments. You can't just uproot yourself. So that's not my number one condition for accepting you as a patient, is that we need to remove you from exposure. But if you are deathly ill, that's common sense. So, but common sense is very uncommon. So that's something that I need to reiterate sometimes. But no, I'll treat you. But keep in mind that many a times, depending on the exposure you have, you will not get worse, but you may not, get over the hump there either until you do a cleanup.
Yeah, I've been doing it for years. I'm actually building a house right now and we're moving into it, but it's such a struggle. Like Dr. Shoemaker, I couldn't get past the cholestyramine portion because I couldn't get anything around here under a 2. I mean, even this place is bothering me. I don't know if you can feel it, but
I can.
It's bothering the hell out of me.
Yeah.
Great, thank you for your help.
You're welcome.
Thank you so much for your very informative presentation. It was awesome. I thought you made an interesting point about band 39 on the test for Lyme's, having a connection with hypothyroidism. And as levothyroxine is the #1 prescribed medication in the US, and then you look at least 90% of hypothyroidism is Hashimoto's. Do you think this increase is due to the increase in Lyme cases and maybe even biotoxin illness?
Definitely. I've seen that in my practice, and I know many of my collaborating MDs and DOs are on board with that as well. It's well enough to have labels. It's Hashimoto's, it's hypothyroidism, it's this and that. But what is the root cause? I mean, drinking celery juice every day is not going to cure that, but no offense, but it's just not practical. It's helpful, but you need to look at the root cause, and you need to eliminate whatever else is going on underneath. Yes, so it is advisable to look for tick-borne infections, to look for water damage building exposure as well, especially as I explain how it cascades down to dysregulation in your pituitary, hypothalamus to pituitary to the other hormonal organs, your thyroid, your adrenals. So you should look at the morning presentation, and you'll see that there are different recipes that you can start using at home. I mean, it's just food and recipes and some basic herbs and oils which you can start using for hypothyroidism.
Thank you.
You're welcome.
Thanks again. I just go into the root cause. I think that's awesome. I kind of explained it in the concept of deficiency and excess toxins. There's always a deficiency and related to it. But I'm really interested in regards, you mentioned some research in regards to glyphosate detoxification, and your research led to a formulation number 7, but you also said that you don't necessarily sell those to your public, you offer them to your patients. Can you disclose what you found about glyphosate detoxification, maybe specific herbs or specific nutrients that you found that augment its elimination or ability to eliminate it from the body?
Sure, yes. It all started with trying to keep the cost down for my patients. That's why it's not. I am slowly making it available. The first people that have requested me to make it available is the Royal Society of Medicine in the UK. The Association of Natural Medicine is who, and they are trying to make all of these formulas I mentioned available to the UK people and Europe and EU, because there isn't anything available there. There's no BEG spray, no testing, nothing. So I'll be speaking there in November. I think it's myself, Klinghardt, Armin Schwartzbach. We are speaking in London, UK. So slowly I'm trying to make these things available, but they are locally grown herbs right here in Lancaster, organically grown, beyond organically grown. My medicine maker is a herbalist. He is studying to become a rabbi. It's wonderfully done, lab tested. I mean, they are official formulas which are ready to go, and glyphosate detox is one of them. Stephanie Seneff talks about a multifactorial approach. So what I chose was to look at the research for herbs, and there are many herbs in there. There is oregano, I think there is tulsi, there's about 9 or 10 herbs that are blended in that it is, and as you know, you're a naturopath.
Yeah,
so
I formulated herbals too, so
yeah.
I know what you're talking about.
Okay,
but
so that's why it's not just the herbs. It is the specific ratios and how they are blended in. Like you can't have 1:5 of oregano with like 1:10 of tulsi. It wouldn't be synergistic. So that's where the magic happens. Which is why they become
do you have
active
measurable
herbs,
studies
etc.
of glyphosate testing before and after use?
Not yet.
Okay.
No, this has been created like about a month ago. It's been formulated a while, but I have a 4-month waiting list. I work 7 days a week, so it's just haven't gotten. And these are handmade herbs, so it haven't gotten around to it. Like they're made in a CGMP facility, but they are literally handmade, by herbalists on a stovetop, like you were saying. So yeah, it's a very high-end item, but it's not expensive.
Okay. Thank you.
Sure. If you want, you can stay in touch with me, as it becomes available. Sure.
My question is about appetite. The biggest challenge we're having with our daughter is she has no appetite most of the time. So to do any of it is beyond frustrating. Any tips on how to help the appetite?
Yes, I would look into her vitamin B1, B2, B6, and B12 and balance them out. I would also look into introducing camel milk. And you know, there are other things that come into play, right? I mean, is she using digestive enzymes? Why is her appetite not being stimulated? You know, which brings me to the hypothalamus or the satiation center. The hypothalamus, your leptin receptor. So is there any exposure to water damage building? Assuming you're here in the lecture, so you know that there is, yeah. Like I mean, my son is 17 and right now he's barely 100 pounds soaking wet, but it's all muscle. He's been on the SCD diet, but it has been a huge concern. I've had patients that have lost 60 pounds in like a couple months, just down from being exposed to mold. And you know, the gut has been ripped. No Lyme, no nothing, just mycotoxin, just water damage building exposure. So I use something called as gut butter. And that is something you make at home, and it really helps with repair. And in the morning I mentioned that, you know, treatment is all well and good, but just because you treat doesn't mean you get better. You have to repair the damage that has been, you know, these are the people who relapse. You're told, okay, you've been treated, you're fine, you're great. And then a year later, 2 years later, boom, you relapse. And then you say, okay, you know, maybe this happened. Maybe I had an emotional something. Maybe I had trauma. That's why I'm relapsing. And then one of the questions I ask is, you know, was there any repair? Did anybody repair your gut? Did anybody repair the neurons that were raw with you know, biotoxins attaching themselves to the myelin sheath? Has the myelin sheath been supported and nourished for your nerves? Has your lung inflammation, the lining of your lungs that gets inflamed, has that been repaired? No. Most of the time the answer is no. So that's a big thing.
I have one other question. How does mold affect the gallbladder? I have gallstones constantly. And I don't know if that's from mold, from Lyme. I don't know what to do about it.
I don't know the connection. The only thing I can possibly think of is obviously the bile connection. You know, the bile becomes very sluggish, sludgy almost when there is mycotoxins in there. So I can see how that would be, but you should also check for high oxalates in your diet. And if you don't have high oxalates, you should make sure that your magnesium is good, that your melatonin, right? Melatonin is very important for liver health. It's not just for sleep. I prescribe melatonin to my patients, like, you know, maybe 3 milligrams, roughly speaking, 3 times a day. It may need to go up to 9 milligrams. It's anti-inflammatory. It helps in the liver. It keeps the bile flowing. So it's multifactorial. So if you have a practitioner who missed a few points, then that's what happens.
I thought years ago Dr. Shoemaker wasn't using melatonin. He wouldn't give it to me for some reason.
Okay.
I don't know why. There were so many things going on, so.
Yeah.
Thank you very much.